This video is for clinicians or patients to help you count how to check the heart rate of either yourself or somebody else that you're looking after, for example, your child. To feel the pulse, take 2 fingers, don't use your thumb, it's really important you use your fingers, and place them on one of the 3 places I'm about to explain. The most common place people check for the pulse is at the wrist. So the best place is normally at the base of the thumb at the wrist itself. So if you gently press onto it and relax the wrist back, you should feel a pulsing sensation, and that's the pulse. Another place that's really good to feel for the pulse is at the elbow. In particular, you go to the body side of the elbow with the hand facing upwards and press gently, and you should feel a pulsing sensation. This is generally really good for checking the pulse in younger children in particular. The third place that is really easy to feel the pulse from is in the neck. This is called the carotid artery, and often the one that people check when they're doing things like CPR, for example. To check for the carotid pulse, again, take 2 fingers, place it on the middle of the throat, and then move upwards and outwards by about 2 centimeters and gently press in. You should feel a pulsing sensation. Please only check one side at a time. Do not press on both sides at the same time. To use this video to help you count the pulse rate, simply keep pressure onto the pulse, and then as the video starts, either keep an eye on the counter in the bottom left hand corner, alternately try and match up the beats to the clapping that you're going to see in the video, and that'll give you a rough idea of the pulse rate a lot quicker. Again, if you're unsure, just count the number of pulses you feel in the minute timer that you're about to see. It's important to remember that this video is a guide and not meant as medical advice. If you have any concerns, please seek advice from your local healthcare team. In addition, at the end of the video, you'll see the normal ranges for an individual, both in terms of adults and children, for you to compare the results that you have with. If you have found this video useful, then please tap the like button because it lets me know that this is useful content for you, and definitely share it with your friends and family so they can also know how to count the heart rate and breath rate of either themselves or somebody else to help in their healthcare. So find the pulse and let's get started in 3, 2, 1. Now, it's important to record your readings. If you are unsure, feel free to use it again to count out the time that you need or match up to the video that most reflects the reading that you're checking for. And as a guide, check out this information right here that has the various ranges for individuals based on their age. It's important to remember it is different based on age. If you are getting measurements outside of the ranges for your age, then you may need to contact your local healthcare team based on your individual health situation and issues. You may also want to check out some of my other counters right here. Alternatively, YouTube's probably recommend another one for you right here. And as always, we're here to tech enhance your primary care and learning. Catch you in the next episode.